In today's module, you're going to learn about speech pathology, audiology, and evidence-based practice. The objectives for this lecture are to identify the differences in education requirements for SLPs and audiologists, to explain the scope of practice for the SLP and audiologist, and then list the assessment procedure for a disorder. So the outline for this module is to introduce the SLP and audiology professions, review the scope of practice for the SLP and audiologists, discuss evidence-based practice, and then we'll introduce just a general assessment and treatment process, and that's something that will apply in a few of the modules in the future. So right now I want you to just think about what you know about speech pathology and audiology. Some of you might be thinking, oh, it's just speech. You treat R's, maybe a little lisp, and teaching kids how to read. And as audiologists, maybe they go in the school system and they do a hearing screening, or they give old people hearing aids, right? But ultimately, SLPs and audiologists do so much more than that. So we have to have skills not only that you're going to read about in the scope of practice, but additional skills that we acquire and improve over time. So SLPs and audiologists have listening skills. They have to be able to listen to their patients, their wants, their needs, and sometimes even things they don't say out loud. We have to have critical thinking skills, so thinking on our toes in a session. If the treatment isn't going the way that we thought that it would, how can we change that and make it better for the patient so they get the most out of their sessions? We have to have compassion. We have people coming from different backgrounds with their culture, their socioeconomic status, their education, their exposure to our professions, and we have to have an understanding of what they're bringing to the table. We have to have good communication skills, which kind of seems like an obvious, but those are also things that we have to develop over time. So we have to be able to understand what we're treating and why we're treating it in scientific terms, but we also have to have communication skills to interpret that information and provide it to our patients on their level. We have to have patience. Sometimes we expect our clients or our patients to have skills and they grow and expand in a week or in 6 weeks, and when they don't make the progress that we expect them to make, it might make us frustrated. But we have to understand that they're bringing what they can to the table, they're doing what they can, and we have to have the patience to watch that individual's growth. We also have to have patience within the sessions. Sometimes, because they are communication disorders that we're dealing with, someone's just searching for words or trying to think of what to say or trying to understand what you're asking them to do, and it may lead to very long silences during each session. And we have to have the patience to say, it's okay to sit in silence for a few minutes because that person is trying to give us a bigger message. We have to have strong ethics. Sometimes it's easy to say, oh, I can do that because I have my foundational knowledge and I'm just going to do what I have to do. But we have to have the ethics to say this is outside of my knowledge base, or maybe I'm not the appropriate person to treat it, but also understand that I'm going to have different ethics on a personal level than my patients, and I have to be okay with my ethics and those differentiating or being different from my patients. And we have to be teachable. And that's not only on an education level in terms of getting a degree or continuously learning, but teachable as a person. We have to learn different traits about ourselves. You're going to learn a lot of things about yourself you never thought you had to know. You're going to learn about, your bad qualities and your good qualities, but you have to accept them as who you are and work on them as you can. And instead of looking at them as faults, look at them as traits. Okay, so an SLP and audiologist have to have different types of traits. So again, it's not just walking in with a sheet of paper, checking off a list and going, okay, I did my job for the day. We really have to take everything with us to each session and make sure that we are constantly improving and providing adequate care. So SLPs and audiologists are evaluators. They're looking at the whole person and how that person interacts with their environment. They're also looking at each individual component. So just like we broke down the different areas of communication, we have to make sure that we're evaluating and providing treatment to each appropriate area of communication and the communication areas and deficits specific to that person. They're also diagnosticians. So they diagnose communication, hearing, and swallowing disorders. And we have to differentiate each of those different types of disorders from one another so that we are, again, providing the appropriate treatment. So then we're interventionists. And intervention doesn't mean walking in with a worksheet and saying, hey, fill out this picture and label it with the right word. And then at the end of the session, you go, great job, you got 4 out of 5 right. We're so much more than that. We have to constantly think on our feet and think about, what can I do specifically for this patient within this session? Because even though I came in with a plan and I thought I knew I was going to treat the right thing, it turns out the patient's not there at all today. And maybe I overshot on my assumptions of this patient's skills, or maybe I undershot and now I'm not giving them enough treatment. So we have to think on our feet. We're also counselors. These patients are bringing different backgrounds to us, different experiences, different problems. So for instance, I work with head and neck cancer patients. And some of my sessions have absolutely nothing to do with what I'm there to treat. Sometimes it's just dealing with the life problems that they're going through. And we're also the people to say, all right, this is outside of my scope. This is outside of the support I can give you. Let me refer you to somebody else. We're scientists. We know the anatomy and physiology of the head, the neck, the rib cage, the digestive system, the brain. And so we have to apply that knowledge into our treatment and our assessments. We're innovators. We come up with different treatments all the time. The research that you read in this class and in other classes, most of it came from SLPs or audiologists, and it's because they're coming up with new ideas that they find works or don't work with different populations. And we're lifelong learners. And again, it goes back to not just the things that you learn from a paper, but the things you learn through exposure to other people. So when we're learning about all of the different areas that SLPs and audiologists treat, you might say, why do I have to do this? Right? I'll just, it makes sense. I need to do all of these areas. But the scope of practice really defines all of those areas and tells us exactly what we need to do. So the scope of practice is designed to identify the areas of professional practice for SLPs and audiologists. So it tells us the lifespan, and across the lifespan, the areas that we treat. It tells us the settings that we can treat in, and it tells us the different skills that we have to have. It differentiates SLPs and audiologists from other areas. So think about occupational and physical therapy and what you know about those professions. And you might think some of the things that we do overlap. And it's right, they kind of do. But we all bring a different lens to that problem. And we can treat them all in different ways so that overall we're improving that patient's life. We get support and provision for high-quality evidence-based services because of the scope of practice. So it aids us in finding different areas where we need support and advocating for that support. And then supports the conduction and sharing of research. So if we know that we have responsibilities in specific areas related to communication, hearing, or swallowing, we can research those areas and research them very well, instead of trying to grasp from all over the place and just throwing out research. And then it gives us guidance for educational prep and professional development. So you might look at the curriculum for LSU and the curriculum for another university and notice that they're very similar. And that's because our national organization has determined that we have to have a base set of skills before moving forward in our ability to practice as SLPs and audiologists. So it gives us our foundational information to help us move forward. So you'll also learn about evidence-based practice. And evidence-based practice integrates the professional's clinical experience, the patient or caregiver's point of view, and the current available research. And we have to have evidence-based practice so that we're not the blind leading the blind, right? So if you go out to treat a patient as a speech pathologist today, and you had somebody come with you, maybe your best friend came with you, and you said, this is exactly what you need to do, and maybe you get through the session and everything goes okay, you might have a little bit of confidence there and say, well, I can do that. I'm going to do it again. So I'll give you an example. I had a car battery die on me in the Sonic parking lot a few weeks ago. So I Googled how to change a battery in a car. And I changed my car battery successfully. My car is now running. I did a good job. And now I feel like if someone else has that problem, I'm going to change their battery and I'm going to do a good job. But what could happen is I think I did a good job on the battery and my car's running right now, but if I go over a big hump, I have no idea if my battery's going to fall out, right? So it's the same thing with speech pathology. Maybe you have a good session where you came up with this really fancy way to treat a patient. And then it turns out you try it again on another patient and it kind of worked. And you tried it again on another patient and it kind of worked. And so you spread the word to everyone else to say, hey, look how awesome this treatment method is. Everyone needs to do it. And then it turns out you're not doing at all what you thought you were doing. It's a very big reality that we have in our profession. And so evidence-based practice brings us back down to earth to say, yeah, you came up with a great treatment, but why are you doing it? How does it work? And does it work? Okay? So an example of this is a parable that you may have heard before, and it's about 4 blind men walking up to an elephant, and each of them touches different parts of the elephant. So one man touches the trunk and says, oh, that feels like a hose. And one man touches the side of the elephant and says, it feels like a wall. And another man touches the ear and says, oh, the elephant is like a fan. And the last man touches the tail and says, no, the elephant is like a rope. And ultimately, all of these men are touching an elephant, but they have this perception that's very different, right? And so it can very easily be that one person's truth turns into a version of reality, where we think exactly one way because of the knowledge that we have, and so we apply it across all situations. If I see a patient with a language disorder and I see another patient with a language disorder, they must be exactly the same. And the reality is that they're not. They're very different. But we have to look at the overall picture as well as the pieces and the parts. And having a perspective of the research, your clinical practice experience, and the patient's viewpoint helps keep us grounded in our treatment and assessment process. So for evidence-based practice, we have to have evidence that backs up my statements. And it is the demonstration of the patient's skills during our assessment, as well as the research foundation that we have through our educational experience. We have to have evidence that improves the patient's understanding of their problem. So we can't just say your kid has a language disorder. We have to be able to say these are the areas that are impaired. These are the problems that they have. This is how we're going to target it. This is the cause of that, or could be the cause of that. And then during treatment, we record the client's responses so that we can write our objectives in objective terms. So instead of saying after 5 sessions that a patient improved, we can have a percentage of improvement to say on this day, a person was able to say 5 words, and 5 days later, they were able to say 7 words. And that's a numerical objective term to say that the patient is improving with our treatment methods. And then we also provide our practice in a sensitive and professional manner. And that's really where we bring in that patient viewpoint into our practice to say, even though I know all of these things about anatomy and physiology and the way that the voice or resonation or articulation works, I'm going to appreciate your viewpoint and what you're bringing to the table. And maybe I want to achieve 7 goals today, but you only feel like you can make it through 3 of those. I can respect that because I know that we're going to continue to progress despite that. So for the rest of this module, you're going to read the book provided on the module page. You're going to read the scope of practice for audiology and speech pathology, and then there's a discussion forum that I want you to complete.